Hello everyone, now we're into segment 4, which is going to be the sublingual immunotherapy. We're going to explain exactly how sublingual therapy works and as far as how it works into your practice and how it works in the immune system and how it literally turns the allergies off. So this was going to be part of the Allergy 101, but then I went ahead and separated it out just to reduce that size of that presentation. So we put this into the sublingual by itself, just like we did with the testing. So we've already gone over the patient portion of this. Patient comes in, they take the survey, they go through the qualifications, then you schedule their test, and then you do their skin testing, then you do the evaluation and measurements, and you say, okay, I think you've got allergies, and now we get into the portion where we start talking about the therapy. So the therapy side, after you've already done the testing, there's two portions of that. One is the actual drops, which you'll see down below. You'll have a migration for each dropper will cover each month for the first 5 months. Your dropper number 1 will be the least least concentrated, and that's where we'll start. Each one of these droppers, 1, 2, 3, and 4, will have a progression series, just like it would if it was an allergy shot. It's the same stuff that you would find in an allergy shot. It's just created in a low dose pattern, so you can do drops under the tongue every single morning after you brush your teeth. Hold it there for 2 minutes, then swallow it, and you're good to go. So what happens is it goes through the sublingual mucosa, goes into the bloodstream, just like it would if it was an injection. But the neat thing about sublingual immunotherapy is it's slow absorption and a low dose on a daily basis. That's a big difference between allergy shots. So the part of the therapy is the allergy drops themselves, and you've also got avoidance measures. So once you're able to do the testing, you identify what they're allergic to, you see the amount of allergy that is reactive to their skin testing, now you can go through an avoidance measure. So now what we're going to do is we're going to compare a quick side-by-side comparison between sublingual immunotherapy, which is SLIT, and subcutaneous immunotherapy, which is SCIT, or allergy shots. So let's talk about safety first. Allergy drops are not a risk for anaphylactic reaction. I've already explained there is a slow absorption under the tongue through the mouth. Now, the mouth is naturally tolerant. Even if you have a food allergy, you won't get that food allergy when you're eating it or chewing it. You'll get it when it gets down into the gut, where it starts getting into the digestion side of this. The mouth is naturally tolerant. So the beauty of doing a sublingual or buccal dosing is to go through the absorption cells that are under your tongue and allow it to go into the bloodstream quietly and smoothly and slowly. And that means that it goes into the bloodstream without any kind of a shock to the system. So for example, if you were to have an allergy shot, we've already gone through the differences between allergy drops as far as having 90 allergens, the top 90 allergens across the country, which makes it a universal or a comprehensive dose for all 9 regions across North America. Now, allergy shots, because they have to be selective, that's called selective immunotherapy. What they have to do is they have to be selective on what they're going to put in the shots, because they can only put 12 antigens at a time. And when you do that, it takes a long time, especially if you're allergic to a bunch of stuff, it takes a long time for the allergy shots to take effect. But the problem is that if you go over that allergic threshold that we've talked about before in the previous slides, if you give a massive shot to a shock to the system, you can go to a point where your body actually overreacts to it, creating a massive systemic problem called anaphylaxis. If that happens, that means that your body can literally shut down. Your lungs will make it extremely hard to breathe, and that's the reason why when you go do an allergy shot, you show up at an allergist once or maybe even twice a week. You might get 2 different shots patterns to try and speed it up. But the problem here is that you go in for your shot. You have to drive to the clinic for your shot once a week, which is a pain in the neck. Then you have to sit in the lobby and wait for the shot. Then you get your shot. Then you have to sit in the lobby again for 45 minutes to an hour to hopefully not have an anaphylactic reaction and die. So that's the reason why it takes an hour to an hour and a half to go through this process once a week. That's why the compliance is so low, because it's just simply it's a interruption in your schedule, but it's also higher risk than it needs to be. Only in allergy could the potential therapy actually be more dangerous than the actual disease state. So that's why allergy shots, you have to sit there and wait, because you don't want to go into an anaphylactic reaction. So with this, you get no risk of anaphylaxis with the sublingual immunotherapy, and people have died from allergy shots. So we'll say advantage, allergy-free, obviously. Now let's talk about the FDA. The FDA is an approving body, obviously, regarding any kind of medication that's going to be going through patients. So what we're doing is we are actually taking an off-label use of FDA-approved antigens and using them in a different dosing. So basically, the sublingual is not FDA approved, even though Europe has been doing sublingual immunotherapy for decades. They stopped doing allergy shots a long time ago because of the risk-benefit ratio is so off on allergy shots that they just don't even risk it. So the only thing that can be done with allergy shots, and the only reason why an allergist would even do allergy shots, is because it's FDA approved and it's billable. That's how they make money. If it's allergy drops, we get to do it based on market. But if it's allergy shots, it's extremely expensive. And the doctors make a lot of money doing it through a shot, because they have to be trained on how to handle an anaphylactic reaction. And so they get paid a lot of money to do allergy shots in the office, even though Europeans stopped doing it 2 decades ago. So at the advantage, we're just going to call this a draw, because there's really no advantage or disadvantage between one over the other on the FDA. I just needed to explain that the off-label use of FDA-approved antigens going sublingually is not approved by the FDA, especially when it's a proprietary mix. Reimbursable. Allergy-free drops are not reimbursable by the insurance. So it is a cash out-of-pocket for the patient, but it's anywhere between $160 to $200 depending on what company you're getting it from. As far as the way the doctors are compensated, we compensate a $20 compensation as a patient consult fee, but also being able to monitor and sustain the patient over time. So we pay $20 per dropper to the doctor just to make sure that the patient is staying compliant. And as far as allergy shots, yes, they are reimbursable because they are FDA approved, but you're looking at a massive, you're talking about $4,500 a year is what the doctor makes on allergy shots. So that's the reason why most people don't even promote allergy drops, is because they can make more money if they do shots. And in American healthcare, you have to pay attention to something. American healthcare is more focused on the profit than they are the patient. And that's where you start getting into issues with high reimbursable projects like this, where the reason why they would even risk a patient knowing there's anaphylactic risk with an allergy shot, it's because they make good money on it. That's why they keep doing it. So we're going to do the advantage onto allergy-free, simply because the cost for the patient out of pocket is less expensive than it would for a copay and gas and potential risk that it would be if it was an allergy shot. Now let's talk about convenience. Yep, I've hit on this multiple times. And the thing about convenience is if it's convenient and if it's simple, people will be compliant. And if it's compliant, the results will be there. So that's what you really need to focus on here, is not just the convenience, but if it's simple and easy to do at home and they don't have to go completely out of their way to go to a doctor's office for an allergy shot, people will choose that every single time. So the convenience issue that you have with allergy drops, 80% compliance because the convenience is so good. And as far as weekly trips to the doctor's office, I give you how many times that actually shows up, where the patient will say, okay, I'll do allergy shots. And then they show up until the point comes to a point where they're just like, you know what? These shots aren't working. I still have allergy symptoms. It's taking forever. I don't want to do this anymore, especially if they have an anaphylactic reaction. Guess what? These patients would rather just suffer with the allergies than have to worry about trying to go through another anaphylactic reaction. So advantage, allergy-free, absolutely on convenience. Not even a close comparison. Affordability. Allergy drops are anywhere between $160 to $200 a month. And that's actually less expensive than what it would cost going to an allergist for the cost of time, the cost of the trip, the cost of the copay, not even counting the cost of the risk. Again, advantage, allergy-free. Now let's go through the therapy terms. Allergy drops are done for 12 months at a time. Now we've done an example of a live patient that we did for the drops through the cascading events through I think it was segment 2 or segment 3. And when we went through that, we showed you a side-by-side comparison between what the patient tested positive on for 60 allergens the first time they came in, and then 12 months later did another test after doing the allergy drops, and we saw a significant drop. He went from sensitivity to 60 different allergens down to testing positive for only 6. And we gave the patient the option, okay, you're no longer symptom free. You no longer have chronic sinusitis or sinus infections. You no longer have red, irritated, itchy skin, and you no longer have your migraines. So, and you can smell fruit when you go to the grocery store. So, you're symptom free, but you're still showing positive to 6 different allergens. What would you like to do at this point? The patient said, I would like to continue because I have had to deal with allergies all my life. And even though I'm symptom free, I want my allergies completely gone. So he went through another 12 months of the maintenance dose and never had to do these again. To this day, as of 15 years ago, I still keep in contact with that patient, and he no longer has his allergies. They are completely gone. So when you compare this to allergy shots, you can do this allergy shots once a week for the next 3 to 6 years. Who's going to put up with that? It definitely wouldn't be me. I would give up, 6 months in going, this isn't working. I got better things to do than to show up here and waste an hour of my time every single week. And I wouldn't show up. So 3 to 6 years, again, it comes down to compliance, and compliance dictates result. Again, allergy-free has the advantage here. So now we go over coverage. We've talked about this a little bit more in detail in a previous seminar, but on the coverage, we cover the top 90 allergens across North America, which includes Canada and Mexico and the Caribbean. So with our coverage, it doesn't matter where you live. It doesn't matter where you travel to. It doesn't matter where you go on vacation or where you get a new job and move to. You are covered nationwide. With allergy shots, because they are limited in the number of allergens that you can put into a shot, you are limited as to how many you can put in, and that's the reason why they do specific regions only in that area. Now, I think we have a slide here for the actual coverage of the nation, but we do have this, and I'll show you an example of, for example, like Texas, where you have a combination of 3 regions inside that state, or California, where you have 4 different regions inside that state. You have to, when it comes down to allergy shots, you have to be selective and you have to be specific for what you're going to choose them on. Now, if you've got 15, 20, 30 different things that you're allergic to, you can only put 12 in the shot. So guess what? The doctor is going to have to kind of spitball what 12 items they're going to put into those shots and then deal with those first while you're still symptomatic for the next year to 3 years, and say, it's going to work. You're just going to have to be patient. Well, with the allergy drops on the coverage, the effectiveness of our drops, you can notice a significant drop in symptoms just in the first 45 days. So it's super fast acting because you're treating things every single day rather than once a week. So again, advantage goes to allergy-free. And then the last thing, like I've already hit, the compliance for allergy drops, because you keep the allergy drops literally sitting right next to your toothbrush, you can't help but do the drops right after you brush your teeth. Just make it a part of your daily routine. And once you do it as a daily routine, your compliance skyrockets. So you're 80% or better. Even when you're feeling better, make sure you still do the drops, because it does take time to modulate your immune system to where it recognizes those allergy proteins and no longer creates a trigger. So it basically identifies the proteins and goes, I've seen this before, no big deal. Now, allergy shots, because it's such a pain in the neck, more than it is a pain in the arm to actually go there on a weekly basis and literally lose an hour of your time sitting in a chair every single week, that gets old, and that gets old really fast. So when you're talking about allergy shots and the compliance is so pitiful for allergy shots, people just stop going. And that's why the majority of the patients that start on our program and have gone to a primary care just to get any kind of symptom control have said, I've done allergy shots and they don't work. So when you're looking at the safety, you're looking at the reimbursable amount of it, the actual cost and convenience and affordability of it. The term is significantly shortened, the coverage is significantly more, and the compliance is better. So again, the whole thing across the board, advantage, allergy-free. So I'm going to go through each dropper and how you end up doing the dose. Now, each dropper shows up. There's 2 different ways to do this. I know I've already gone over it in the previous clinical stuff, but I do want to touch on it just in case you're just watching this video only about the sublingual immunotherapy. The way this works is you come in, you get your test, and then once you've identified the problem, you go through the avoidance measures and you start the drops. The drops are the top 90 allergens across the country, and in the next slide, we will actually show you how those 9 regions are covered. But what these are dilution patterns. So the lightest dilution is going to be number 1. The next heaviest dilution is going to be number 2. Then the next heaviest is number 3. The next heaviest number 4. And then you've got your maintenance dose, which will be what you will be sent every single month for the rest of the year. So imagine it like stepping up a stairway, going up to a second floor. Your dropper number 1 is going to be your first 4 steps of going upstairs. So your first step is going to be 1 drop under the tongue every day for the first week, 2 drops every day the second week, 3 drops every day the third week, 4 drops every day the fourth week. Then you get your new dropper either sent to the doctor's office or sent directly to your home. Now, if it's sent to the doctor's office, the reason why we send it to the doctor's office is for the patient to be able to go in on a nurse visit. Doesn't have to be with a provider. It can be with a low visit, a nurse visit to come in and just visit the nurse, take a symptom score, and what we do is we compare the first symptom score when you did your test with the second symptom score when you get your second dropper. You'll go into the office, fill out your symptom score, let them, just so they know that you're being compliant, you're following the directions, you're doing your drops on a daily basis, and you're not having any issues. So that's the reason why we prefer the patients to go into the office, and we send the dropper to the doctor's office. When the doctor's office gets their dropper, they contact the patient, say, hey, we've got your next round of drops. Come on by, pick them up. We do that. We prefer that because you want to monitor the patient. However, we do know that patients do have busy schedules, and if it's not a patient that you have to worry about compliance on and they say they're going to be compliant, then obviously the option would be to send the dropper directly home, and then see if there's a way that they can do the symptom score on their own, and then track it on a monthly basis. So then you'll do the second dropper. You'll do the exact same thing. 1 drop under the tongue every day the first week, 2 drops the second week, 3 drops the third week, 4 drops the fourth week. Then you get your third dropper, do the exact same thing. So again, imagine it as weightlifting for the immune system. You add a little weight, do more reps. Add a little weight, do more reps. Add a little weight, do more reps. Next thing you know, you're strong. You are built. You are in much better shape than when you started. So that's why we do this on a daily basis, because 1, you want to create a habit, and 2, you want to make sure that you're doing low dose on a daily basis so you can do a better, more concentrated over the week dosing schedule than you would if it was compared directly to allergy shots. You'll do the same thing when you get to dropper 4, and then by the time you get to dropper 5, that's going to be your maintenance dose. Your maintenance dose is going to be 5 drops under the tongue every single day for the rest of the year, and those will get sent automatically to the home. So now we're going to go over the 90 allergen panel again. There's 9 regions across the United States, and when we started this formulation, our proprietary formulation, we literally took a spreadsheet of all the fauna in each category, in each region. There's 9 of them here. Now, we take that in the region, and then we eliminated the duplicates amongst the different regions. By doing that, we were able to create a large, broad spectrum formulation for the top 90 allergens across the country. Now, in that process, we take the top 70 allergens out of those regions and we create the test. So now we have 1 nation, 1 test, 1 therapy for everyone. This simplifies allergy to a point where literally for any common inhalant allergy, anybody can do this at their home. If this is a telemedicine visit and you're not going to be doing the testing, guess what? The drops are the same, regardless if you're doing the testing or not. The only reason you do the testing is to set a baseline and identify the allergens to see what is causing the problem and how to avoid it. But the beautiful thing about this is it now uses the same antigens in the compound for the universal sublingual immunotherapy that we do in our testing panel. So same allergens, same stuff. Now here are the panels that are the top 90 allergens across the country. So you'll see that a lot of these are in the allergen testing kit. We put a lot more trees in the actual dosing because trees and weeds seem to be the most allergy causing issues. And so even though you might not be tested for something like, let's say for example, Melaleuca or olive tree in your testing panel, you can still be treated for them in the therapy because there's 20 more allergens in the therapy than there are in the 70 panel test. So it's a much more comprehensive allergy-free drop menu that you would get, and we treat all of these at the same time. So the beautiful thing about this, and people will be, well, what if I'm not testing positive, but I'm still being treated for it? That's okay. And the reason for that is anybody can become allergic at any time. You could be there and say, for example, I've always eaten shrimp all my life, and all of a sudden you eat a shrimp and your body just went, we're not going to eat shrimp anymore. And you have an anaphylactic reaction to something that you've been eating forever, but all of a sudden your body now has a sensitivity to it and you're done. So same thing happens with any kind of inhalant. If, let's say, for example, you've gone through allergy shots and you were in California, and you were tested for all the things in California, for all in that region in California, and then you moved to Texas. Well, if you move to Texas, now you've got a whole brand new list of stuff that you weren't exposed to in California. And while you were doing allergy shots for 6 years in California, all of a sudden you're like, oh my God, I've got to start over again because I'm allergic to cedar and I didn't have cedar exposure in California. Oh no, what am I going to do? I got to start over? Ugh, nobody wants to do that. So the beautiful thing about this is if you were using our allergy-free drops in California instead of allergy shots, then you move to Texas and guess what? See inside the tree section, you've got red cedar and mountain cedar, and you're covered. So you don't, and bald cypress. So all of those evergreens that are in Texas, you're okay. You don't have to restart anything because you've already been identified for those particular proteins. Your body has already been trained to identify those proteins. And because it's such a low dose, it's almost like sneaking up on you. You've heard that story about how do you cook a frog? Well, you don't throw a frog in hot water because it'll jump out, right? So you throw the frog in the water and you slowly crank up the temperature over time, and that frog will never leave the water. We're doing the exact same thing with the immune system. You give it to them a little bit every single day at a low dose, and then the next week you increase it a little bit, and then the next week you increase it a little bit, and the next week you increase it a little bit. That's the whole philosophy behind immunotherapy, is before you know it, you have trained your immune system to identify the protein and go, I've seen this before, no big deal, and they totally ignore it. Now, what we're going to do is we're going to review how the body turns off that signal or the trigger. So IgE is the immediate allergic response. So an IgE is an antibody. The IgE antibody response is the most commonly known allergic response. This is typically the stuff that you'll breathe in, or you can have an IgE immediate response to something that would be causing you any kind of skin reaction or something by either contacting your skin. So sometimes detergents will have an issue like that, where you put in a new detergent on your clothes and you put your clothes on, all of a sudden you're getting itchy and red and inflamed. Well, that's a chemical allergy from the product that you were using on the clothes. That's called a topical allergy. That's what you'll do typically in a dermatologist practice, is they'll go through that process with you. But the actual reaction and causing that histamine reaction is what they call an IgE reaction. Even though IgE reactions are immediate, the allergic potential of food-based allergens can remain in your system 1 to 2 days after ingestion, extending the presence of the symptoms during that duration. So IgE reactions stimulate and release the histamine in the body and can be permanent, or they may improve with immunotherapy, like what we're doing for the inhalant or elimination diet for food. Now, we've gone through some of the cross-reactivity to where your body is sensitized to the things that you're breathing in, and then next time you eat something, your body that confuses that protein of what you're sensitive by breathing in with the protein that they find inside that fruit or vegetable or nut. So by eliminating the sensitivity of some of the inhalant allergies, you can eliminate some of the sensitivities to your food allergies as well, even though it's not a food allergy. Now, an IgG4 blocking antibody is what trigger the response to block your sensitivity spaces on your mast cell. And I'll explain that here in a second. But your IgG4 is the subclass of IgG, is a distinct antibody in the immune system. The IgG4 total antibody is important because IgE is antibody acts as a blocking agent for the IgE reaction. When IgG4 reaction is greater than the IgE reaction for a particular antigen, that IgG4 blocks the IgE antibody from binding to the receptor site and releasing histamine, thereby reducing the severity and the symptoms associated with the IgE reaction. This is referred to as a blocking potential. IgG4 carries its own clinical relevance in high levels and may mediate several conditions and diseases. So a lot of inflammatory responses, such as neural inflammatory response. So believe it or not, we have seen where people will actually take the sublingual immunotherapy for their allergies. And because the IgG4 blocking potential is so high, the clinical relevance of this is that it can actually decrease brain inflammation. And then we've tested patients we've got patients that have had Tourette's, that literally their vocal and physical tics have completely eliminated within 30 days of taking the allergy drops. We also have had patients that have been nonverbal autistic patients in their 5, 6, 7-year-old range, and then taking the drops in over a 30 to 60 day period, start speaking for the first time in full complete sentences to their parents. So this is significant, and it's a huge discovery, and it's a side effect, believe it or not, of the IgG4 blocking potential, and basing your gut-brain relationship as a deflammatory response. So this is what your body actually does. Let's say you breathe in that allergen. That's a ragweed pollen, by the way. There are specific cells inside your immune system that will identify that allergen, grab it, start decomposing it and breaking it down. That's how it recognizes the protein. So that allergen-presenting cell will then send a signal, a chemical signal, to what we call a T helper cell. That T helper cell then converts over to a Th1 cell and then ends up creating the interleukin or the IL-12 pathway, which is basically a chemical handshake between the T helper cell and the basophil. The basophil is a white blood cell. So what will happen is that T helper cell is basically, imagine the T helper cell is kind of like the field general of an army. When they are presented something, they have to decide what they're going to do with it, and that cell-to-cell chemical reaction or the signaling response will tell the B cell what it needs to do. So the Th helper cell, the helper cell, will say, okay, I see the reaction here. I see the protein here. We're going to tell the basophil to start producing IgG. Now, that is the normal reaction. That IgG is typically measured when you have a food sensitivity. So you'll have IgG floating around in your bloodstream, and those are antibodies, and those antibodies then will float around and then identify themselves or attach themselves to mast cells. Now, the IgG response is the typical normal reaction, and the modification of the IgG4 blocker is very similar to this. But let's say you have an allergic reaction. Now that T helper cell becomes what we call a Th2 cell, or a different type of helper cell that triggers an interleukin 4, interleukin 5, and interleukin 13 chemical reaction. What that does is it tells the B cell, okay, you're not going to produce IgG, you're going to produce IgE. The B cell produces the Ig antibodies that create an allergic reaction. This reaction is abnormal and is the cause of immediate allergic response. So as the basophil starts pumping out these specific protein targets that were created by the ragweed cell, keep in mind, ragweed cell, you breathe it in, allergy presenting cell catches it, T helper says, let me take a look at it. Then the T helper says, okay, I don't like this. We're going to tell the basophil through these chemical mediators or the chemical handshake here to start pumping out IgE. The IgE then antibody then goes throughout the bloodstream and attaches to what they call mast cells. Now, when the IgE is attached to a mast cell, now you are actively allergic. The next time you breathe in that pollen grain, and that pollen grain specific to that protein triggers and attaches to that IgE that is attached to the mast cell, that triggers a histamine response, which is all your inflammatory markers. So now all of a sudden you've got symptoms. You've got inflammatory response. It's hard to breathe. You're sneezing your head off. All that stuff happens when you have an active allergy. Now, the next response is what we call your immune therapy response. So now you've got T regulator cells that will actually suppress the Th2 cells, at the same time stimulate the growth for Th1. So it will increase the number of Th1 cells, decrease the number of Th2 cells, and it'll also give another interleukin 10 and another chemical response over to the basophil. And this will tell the basophil, okay, you're not going to crank out IgG. You're not going to crank out IgE. What you're going to do is you're going to create the IgG4 antibodies, and we are going to send those through the bloodstream. Now, the IgG4 then attaches itself to the mast cell, and when it attaches itself to the mast cell, the active IgE that is in the bloodstream no longer it's now blocked. It cannot attach to the mast cell. So as the Th2 cells start to die off, it stops telling the basophils to produce IgE, so your IgE, your blood IgE, starts to decrease over time, and your IgG4 and your IgG will actually start to increase in production, and that is what turns off your allergy response. You no longer have allergies after it hits this over time. So when you're taking in the sublingual immunotherapy instead of the allergen, you're taking in the sublingual immunotherapy, it's presenting it to the presenting cell, it's presenting it to the T helper cell, which is basically a stem cell, basically, where the T helper cell will then determine, based on that particular protein, what it's going to do. So if you're putting sublingual drops, the drops then activate this process to the T regulator cell for the down there below on the IgG4 response. That's what you want. And so the more drops and the more proteins, and over time, you'll put more drops and you'll add more protein concentration, which increases the number of T regulator cells and kills off the number of Th2 cells. Make sense? Absolutely. So that's how you build immunity. So now that we've gone over the process of allergy drop therapy, now we can sit here and go to the next segment, which is the sales, marketing, and training support.